Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, if you've been alive and well, you understand there's a presidential election going on in the country, even as I speak. And guess what? What happened to health care? We all thought it was going to be a big topic. We're going to rectify that in a few moments. Stay with us.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program, and as always, thanks for watching. Well, look, for a year, I was saying, and some of my guests were saying, I have a great guest on here. We were talking about health care, how important it was as a subject. We thought it was going to be a major issue, or at least a major subject to be debated. We got huge issues in the health care arena. Joining me to talk about that is Dr. Stuart Shapiro. He's president and CEO of the Pennsylvania Health Care Association. Doctor, welcome as always.
Nice to see you, Terry.
Now, wait a minute. You and I have been, we were wrong. We thought this was going to be one big year for health care debate and discussion, a discussion we think this country should have. What, am I right or am I wrong about that?
You're right. But there's an interesting analogy, and I know you like analogies. I saw the White House on television this week, and I had the image of it being a firehouse with the two presidential candidates, congressional leaders, and the president there with a fire hose. And they were arguing, do we put out the fire with foam or water?
Yeah.
For months, the smoke detectors have been going off, telling us that it's smoldering.
Yep.
And we're in the same case. The smoke detectors have been going off around health care.
Yep.
And even more importantly than just regular health care is health care for the elderly in America.
Yeah, we're going to, later in the program, we're going to have some folks from Highmark who are really concerned about doing wellness and preparing us so that we don't have to spend, on the flip side, all kinds of money. You know, prevention is very, very important. I'm going to talk to them about it. But let's talk about this in another way. Look, healthcare costs are now rising again after being somewhat
double-digit rates.
They're rising again. We've not done anything, no big discussion about Medicare, huge Medicare program, $50-some trillion when 75 million of us end up tracking through the portals to get that. No discussion of Medicaid reform. Some discussion of taking care of you pick the number, 45, 46 million Americans without any coverage. And finally, what about elderly care? We all know what happens when you get up 70 and 80. What are we going to do about that?
Well, we're not even looking at the issue. We've previously called for a national commission to deal with this and deal with some recommendations. But there's a real knowledge gap. Poll was done by AARP that said 35% of people thought that they would need long-term care. But on the other hand, the Urban Institute has documented that 70% of elderly people are going to need long-term care. The vast majority believe that Social Security, Medicare, or Medicaid will pay for it. It won't. We are in a the smoke detectors are going off saying, presidential candidates talk about this, and neither one has. They all talk about tinkering around the edges of health care reform, and even that now has moved all the way to the back burner.
Yeah, one of the problems that I look at, I mean, and we've all had, parents who we've tried to take care of in the home, then we've, finally had to go to an assisted living facility. It's sort of a reoccurring pattern for millions and millions of Americans is, what are we going to do when all of a sudden this baby boom generation hits 70 and 80? Let's lay out the problem, and then I want you to lay out the solution, which I know you can do quite well.
The solutions, there's lots of potential solutions, but some of them require state and federal action. People ought to be thinking about long-term care insurance. They ought to be thinking about having reverse mortgages. They ought to be thinking about how they can put aside special money for long-term care. And then there's various tax treatments that need to be done, but that's going to require legislation. The only way to do that is in a bipartisan way. But while all of that is happening, even today, those who are in nursing homes are finding it very hard to pay their bills. And the state, who pays for those on Medicaid, is now under-reimbursing nursing homes by almost $14 a day. A year ago, Pennsylvania ranked right in the middle of being under-reimbursed by Medicaid for their costs. Today, we've moved up to 15th in the country, from close to right in the middle. So it's getting worse in Pennsylvania. What's happening is nursing homes, because they're under-reimbursed by Medicaid, are shifting those costs to the private patients, which is driving people faster onto Medicaid. So it's compounding the problem.
We're going to run to a break. I want to come back to that and try to fit, as you're doing now, Pennsylvania into the picture. But in the short of it, do we have enough facilities? I mean, they're in my ear to go to a break. I mean, yes or no? Are we going to need more facilities? How are we going to deal with this huge influx of people going to...
As you would say, stay tuned until after the break.
He's taking us to break. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to Pennsylvania Newsmakers. We're bringing health care front and center. It's important. It's not being debated right now. I believe, or my guest believes, this is a critical subject we ought to be talking a lot more about. All right, let's go back to this subject matter. Again, are we going to need literally, I mean, I don't know, how do we do it with facilities? I mean, how are we going to accommodate all of a sudden within 10 years, millions of Americans that are going to need this kind of care?
Right now, we probably have about the right number of nursing homes. For now. And we're going to need more down the pike. Some of them are in the, quote, the wrong places because it's not balanced across the state, but pretty much we've got the right number of facilities. Importantly, Senators Vance, Representative Mundy, along with Representative Watson and Gingrich, a year ago passed very important assisted living legislation. Now the Rendell administration is drafting the regulations. And they have they're very good intentioned. But the real issue is they're designing and putting a regulatory structure in place that will guarantee that only the wealthy will be able to stay in assisted living facilities, because the demands that they're putting on these potential facilities in their draft regulations, and I'm not going to get into the arcane business of regulation.
But is it going to require so much state control over it that it's going to drive costs through the roof? I mean, is that sort of the gist of it?
It's going to do two things. It's so much state control over them that it'll make providers not want to be in that business, because it would let the state essentially determine who these facilities take and who they don't. It also will drive up costs dramatically. In fact, recent calculations say for anybody on Medicaid, it would cost the state $6,000 or $7,000 a month for an assisted living facility, and that's just not something that I believe the program can afford.
So your argument would be this is a case of probably some of it is needed and a lot of it may not be, as I think you're qualifying it, but over-regulation leads to making for an inhospitable marketplace for folks to go into the nursing home, stay in or expand,
or go into assisted living before they go into a nursing facility.
Okay.
The way the regulations are drafted, unfortunately, is that it's literally going to suffocate the market.
Yeah.
And that's a real problem. And we're hopeful, because many people, there were 200 comments recently to the Department of Public Welfare. We're hoping that they will actually listen. And they'll say, that makes sense.
If you were to, we were to do a scale from not very serious to critical, where would you put this problem? I mean, you study this all the time. You're one of our go-to guys on this stuff. What?
I think we have two health care crises in Pennsylvania. The first is the long-term care crises. Right. And we need to address that, and no one's looking at it real seriously, either at the state level or the national level. Second crisis is acute care. And hospitals are being under-reimbursed. Doctors are not being paid adequately. And there's close to 800,000 people without health care insurance. Now, what I hope is that under the leadership of Joe Scarnati and Senator Pileggi, that they will, and I work very closely with the Rendell administration and all of their colleagues, and enact a compromise piece of legislation that will address some of the acute care crises. And I've got the confidence that they're going to be able to do that.
Yeah. Before I let you go, I mean, But the point is, I mean, in general, you've just made a very articulate case. But in general, we have not focused on a whole range of healthcare issues. We come into it for a little bit. We're going to take care of the uninsured, and then we back off of that again, and now it's back on the table. 2 years ago, you and I were talking about this huge Medicaid problem. It was going to drive states, and now we find out, well, we got by another year, and now it's coming back.
Well, I can tell you that in Pennsylvania, it's getting worse for the people who provide the care.
Yeah.
Medicaid, as I said earlier, reimburses at between $14 and $15 less per resident per day than the cost of care. So it's going to those, the costs are being shifted to the private pay patient. But the issue is that Senator McCain has totally ducked this issue. Senator Obama has provided some programs for dealing with the health insurance crisis, not of long-term care, but of the acute issue.
But your bigger point is this has not been injected into this race, presidential campaign.
In a meaningful way, absolutely not.
Well, we have had energy, and now we have this financial mess on Wall Street that the government's trying to clean up. But look, we're going to do additional shows on this. This is an important subject. We're heading into one of those critical periods again for the next couple of years. As always, great guest. Thanks for coming on.
As always, great host.
One of the ways to avoid needing to see a doctor is to stay well. And we'll tell you all about that when we return.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, we were talking about this business of prevention since we don't seem to be moving very far on getting major health care reform. So some folks from Highmark have dropped by. Sitting right here on the right is Dr. Robert Muscalus. He's been on the program many times. Brian Day here to my left, and James Morozzi, D&E Communications, Highmark. Do I got that right?
That's right.
All right, we'll put this all up in a chyron. I want to get to this right away. Look, Bob, you've been on this program many times. Wellness, it's become critical. Tell our viewers why.
Well, first of all, insurance companies are very good at finding people who have developed diabetes or who have had a heart attack or have a serious problem. That's not an effective strategy for long-term containment of clinical and financial risk. What we want to do is not find the 48-year-old who had a heart attack, but find the 42-year-old who hasn't had a physical in 15 years, is overweight, has a family history of heart disease, and figure out what we can do to not only help him identify those risks, but incent, motivate, or maybe even require him to address those risks to minimize those long-term health care costs. And companies like D&E are those that are taking that on.
Right. Now, in a sense, then, what we're really talking about, look, you're the guy who does these studies. We're talking about changing behavior. Is that, in the short,
correct?
Take it?
Yeah. Highmark conducted a study over a 5-year period, and we were looking at a cohort that participated in wellness versus one that didn't, matched a cohort that didn't participate. And what we found is that those that are participating in wellness programs over the long term, I think that's really important to understand, that wellness participation is a commitment over a long term. You're not going to see instant results. It's very similar to what Rob was saying about these other chronic diseases. So you have to have a commitment to the wellness program. And what we found is that over a 4-year period, we were saving about $176 per member per year.
That's pretty steep. So, I mean, basically what we're talking about is changing behavior, finding out what works and doesn't work, and then applying it. Do I got this? And Jim, you all have applied it, right?
We have.
We'll talk about that a little bit.
We've been successful over the last 3 years at least, where we've made a concerted effort to really engage in a wellness kind of a culture at the company. And when you think about it from a business perspective, the cost of insurance and health care is very, very large. It's our second largest expense. So from a business standpoint, you want to try to do whatever you can to mitigate those costs. And for us, adopting a wellness culture and a prevention culture has done very, very well for us and has been successful. And our employees really have embraced it, and we see tremendous participation in this program.
Mm-hmm. Well, let's talk more specifically about what that means. I mean, what aspects of a wellness program do you think are important for our viewers? Sort of go into some of the components of it. Are we talking about what people eat? Are we talking about regular visits to physicians? I mean, you've been through this before.
Well, there is no cookie-cutter approach. Okay. One size does not fit all. One of the things that we do is use data to identify where those opportunities exist. For example, how many of the employees are even using the insurance card that's in their wallet? We are able to look at non-user rates of people that do go to the doctor. How many of them are getting preventive care as they should? What is the prevalence of conditions like obesity and diabetes and heart disease? Where are these people? Are they all at desks under one roof between 9 and 5, or are they driving trucks all across Pennsylvania or the country? So depending upon where we identify those opportunities and physically where individuals are, we can develop specific programs and interventions.
Now, what are the main elements of your study that what did you find that's of real relevance, I think, to folks out there? I mean, if you had to pick 2 or 3 quick things.
Well, I think there are just a couple things that are really important to stress about the study. One is that what was driving the savings was the change in inpatient costs. Mm-hmm. So we were finding that the wellness had a great impact on inpatient costs. The other thing that was very interesting is that we looked at 3 groups within participants: those that only took a health risk assessment, those that participated marginally in programs, and those that were a high-intensity engagement group, is what we would call. And what we found is that there were differences between all 3 of those groups and those that didn't participate. Yeah. So what that tells us is that getting a member engaged, at least in understanding their health, is the beginning of a successful wellness program.
We're going to run to a break, but when we come back, I'm going to ask you about the culture in your how, if you can breed a culture in your company, how important that is. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Health Care Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back. Well, we're talking about a very important healthcare subject. Prevention is worth maybe billions before it's all over. Look, Jim, you were talking about D&E and don't you have to really create a culture within a company that sort of spreads and takes hold?
I think you do, and certainly you want to have engagement throughout the entire organization, because these kinds of programs work very well when everyone is bought into the program. Right. So the question becomes, how do you create that culture? And it really has to do with setting the expectations and then also encouraging and reinforcing. Right. So for us, what we do is we focus a lot on education and awareness. Try to get at least people to understand that this is something they should be concerned about. This is something that directs them benefits them directly, and something that's going to be long-term good for them.
And do you provide a lot of information? I mean, are you doing seminars for your employees or giving them sort of literature? Or
Absolutely. And we've got good business partners in Highmark, and they provide a lot of that information.
And you were talking about something called, say that again?
Well,
I like that idea. Go ahead.
It's important as part of the culture that it be very visible that there is support at all levels within that organization and that you have something for everyone. A wellness program isn't everybody's going to run a 5K next Saturday. Getting back to the culture, you also need to get to a point where employees begin to see everything that's being done as something that is occurring because their employer wants them to be as healthy as they can and also as productive. You have to get beyond the issue of people being concerned about completing a health risk assessment questionnaire because it might be used to somehow impact their insurability.
Where can they get the study that you referred to?
It's in the Journal of Occupational and Environmental Medicine.
Is it on a website or?
You'd have to pay for it from the Journal.
Okay, well, somebody, I mean, if you, maybe somebody can get back to me and we'll do something to get that.
Reprints.
Reprints. We'll do reprints. Well, they can email us and we'll make sure.
But the bottom line on that study, two important points. Number one, it now provides me with the objective data that I need to go out to an employer and show that there is a positive impact, a positive return on investment for implementing these programs. The other key factor is we believe this could establish a national standard for calculating return on investment. Up until now, everybody had their own methodology.
Just one other point about that. There certainly is the hard dollars and the return on investment piece, which as a business person I certainly spend a lot of time thinking about. But there's also the softer or the less tangible benefits, just about the well-being, the productivity, the sort of the feeling of the employee that a company cares for them and a company is willing to make investment in them and their family.
And it's also in their financial interest. I mean, we've had employers on here who say, I now pay more for for an individual employee's health care insurance cost than they do for their mortgage. Think about that. So if a company wants to do, can any company do this kind of study?
Sure, but there are some caveats to them wanting to do this. One is they have to have the expertise, okay? And one of the things that Highmark prides itself in is data collection, okay? You can't say you want to do an ROI study when you're done your wellness program 3 years down the road. You have to be thinking about you're going to do an examination of your wellness program when you start.
Is there a blueprint or someplace folks could go to get information, companies, if they wanted to do this?
Well, I think what they should do is the first start is to read the article, because it lays out how the costs were delineated, what we used as savings. It's a very well-written article and can guide people in that understanding.
All right. Well, we're out of time. Look, I want to thank you. I think this is, I mean, if this is something that everyone can participate in to reduce the cost and live longer and have better health care. All this seems so simple to me. Maybe it's just I'm too simple. Hey, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.